Hi everyone, in this video we are going to talk about peer-mediated instruction and intervention. Teachers in general and special education classrooms are continually faced with instructional challenges as the diversity of students in classroom widens. One solution to overcoming these challenges is the implementation of peer-mediated instruction and intervention or PMII. Peer mediated instruction is a widely applied and research educational intervention in both general and special education settings. So let's go to the definition of peer mediated instruction and intervention. It is an alternative classroom arrangement in which students take an instructional role with classmates or other students. Many approaches have been developed in which students work in pairs or small cooperative learning groups. To be most effective, students must be taught roles in the instructional episode to be systematic, elicit responses, and provide feedback. The use of peer-mediated instruction and intervention is often cited in the literature as one of the most effective strategies for inclusive classrooms. In several studies focused on students with mild disabilities, the use of peer-mediated strategies resulted in improved academic outcomes for all students, including those considered at risk academically. Moving further with the PMII pairs. This is a form of peer mediation in which the teachers organize the students in pairs. The students play the role of the tutor or the tutee depending upon which type of peer mediated instruction and interventions pair is being used. There are three methods of institutionalizing PMII pairs. Number one, reverse role tutoring. Number two, class-wide peer tutoring. And number three, cross-edge tutoring. So number one, reverse role tutoring. It is a form of peer-mediated instruction and intervention in which students with disabilities tutor a student who is younger and not disabled. The student, teachers, and parents often organize reverse role tutoring outside of the general classroom environment. The role of tutor for the older student includes tutoring and interpersonal skills and provision of often needed practice in the academic area. The younger student who is not disabled is provided with the opportunity to practice and obtain mastery with the academic material. Data from research in this area has demonstrated that both students can benefit interpersonally from the one-on-one interaction in a tutoring situation. Next point is class-wide peer tutoring. It uses the structure of peers created by the teacher. The unique feature is that all peer tutoring groups are orchestrated within the classroom. The students are specifically instructed on how to tutor one another so that each tutee has the benefit of one-on-one instruction and feedback for half of the time period. After the tutee completes the assigned task and earns points for their progress, the students switch roles. The point earnings of the pairs are posted in the classroom. Since the students are rewarded as a peer, the tutor is as invested in the exercise as the duty. Next point is cross-edge tutoring. It is commonly used outside of the general classroom environment. Teachers and parents typically set up cross-edge tutoring. Older students with disabilities instruct younger children with similar disabilities. As in reverse role tutoring, the tutor role teaches the older student tutoring skills and the tutee role teaches the younger students academic material. The younger and older student benefit socially from the tutoring environment and learn the academic content. Let's see, peer mediated instruction and interventions can be implemented in different ways. PMII describes not just one intervention but a group of different methods. PMII has shown to be effective in class-wide formats, using peer as natural models, using peers as instructors, and in social skills training. Below are some examples of how peer-mediated instruction and intervention can be used in the classroom. So first one is class-wide PMII interventions. Peer-mediated instruction and interventions may be implemented not just with the individual learner and one peer, but instead with all the children in a classroom, sometimes known as group-oriented. Eventually, these interventions involve system of reward or motivation for all peers that help foster interactions and appropriate behaviors for the individual learner. It can also include changing the physical characteristics of a classroom or clinic environment to promote interactions between children. Next one is peer tutoring interventions. Peer tutoring interventions describe an innumerable number of PMII methods, where the peer without disabilities assumes the role of the instructor. During peer tutor interactions, the peer may provide the instruction, provide the reward or positive reinforcement for good behavior, or may provide corrective feedback. In most peer tutoring interventions, the peer undergoes training beforehand but then can independently implement the intervention. Some peer tutoring intervention involve the reverse, where the child with autism acts as the tutor, delivering appropriate instructions and corrective feedback to a peer. Next point is social skills training. For learners with goals related to developing social skills, PMII interventions may involve social skills training, sometimes known as peer networks. These social skills training group practice a specific social skills in small groups. The group might focus on one response, like taking turns or having conversations, or it might have a broader focus on modeling appropriate social behaviors or developing friendships. Let's look at some more examples of interventions. In case of children suffering from locomotor disabilities, the suitable intervention and timely help may be provided by the non-disabled peer for helping them in their proper movement and functioning needed for their adjustment and education in the inclusive setup. They may be assisted while moving to the classrooms or workplaces and using writing materials and working tools for their classroom learning and working in the workplaces. Next example is in the case of children suffering from communication disorders and learning disabilities, suitable intervention and timely help can be provided to them by their non-disabled capable peers in getting them engaged in communication and overcoming their learning difficulties in one or the learning areas. Moreover, in case a hearing impaired child is not benefited through the oral communication provided by the teacher or instructor, the non-disabled peer may intervene and help him to know about such communication by writing notes or preparing visual video for him. He can also help him in the use of his learning devices and other assistive aids and appliances for his proper teaching learning. Furthermore, suitable intervention can also be provided to a child suffering from visual impairments by his peer for picking up what is written, sketched, or demonstrated by the teacher in the class. An audio recording can be made by the non-disabled peer for the use of his visually impaired peer. So in this way, we have seen concept of peer-mediated instruction and intervention. Thank you for watching.